Dear seafarers and office personnel, welcome to the second health campaign for 2021. In this campaign, we will discuss travel advices and guidance related to the COVID-19 situation. As we all realize, COVID-19 situation is far from being resolved. As of August 2021, since the beginning of the outbreak, we have had a staggering 202 million confirmed cases, with more than 4 million deaths worldwide. This guide, based on World Health Organization guidelines, and on company's Circular D123, is to assist company personnel that has to travel to and from the fleet, to conduct crew changes, attendances, etc. For more detailed guidelines, please refer to Circular D123. Let's start. Once a seafarer receives a line-up, or is put into standby status, he receives the latest version of D123 Circular, Novel Coronavirus Guidelines and Response Plan. After going through it, he signs all relevant forms. The next step is to start the self-monitoring process by filling in data as required on the relevant form, pre-joining monitoring of lined-up seafarers for COVID-19. This whole process is overseen closely by manning agents, who nominate the designated person to oversee the seafarer's self-monitoring process. Let's see some guidelines on what you should do during the self-monitoring period. Remain in your place of residence at all times. Do not leave your residence, even if it is to purchase food and essentials. The prohibition against leaving your residence is strict. You are not permitted to use common facilities in your estate or your building, such as the pool or the gym. Follow the self-monitoring protocol, adhering strictly to guidelines, and in close liaison with your designated manning office employee tasked with overseeing your SMP. Check for symptoms. Monitor your health closely, for example twice daily for fever more than 38 degrees Celsius, and respiratory symptoms such as cough and breathlessness. If you are unwell, wear a mask and seek medical attention immediately. Minimize contact with others, and avoid interaction even with family members. You are prohibited from coming into contact with other persons who do not stay with you within 2 meters, other than for the purposes of receiving delivery of food or other essential supplies. If sharing a house with others, stay in your own room as much as possible and use a dedicated toilet if possible. Within 3 days or less of departure date, considering local and airline requirements, you should undergo COVID testing from an accredited medical center, as outlined by the manning office, and in accordance with company instructions. Prior to departure, arrangements need to be made in advance for you to be provided with all the appropriate PPE. Contact your manning office for details. Some countries require all personnel who enter the country to wear specific PPE. The self-monitor process should also continue during your travel days, and up to the point of boarding the vessel, in the same way as during the isolation period at home. So, the self-monitoring protocol should be continued until you arrive on board. Special emphasis should be placed on restricting contact with others to an absolute minimum on arrival in port of embarkation or disembarkation in the case of personnel signing off. For more specific info, check Company Circular D123, Novel Coronavirus Guidelines and Response Plan. Also, check the self-monitoring process flowchart provided by the company. If you have questions, contact the mining office or crew department for guidance. Wherever you are, follow COVID-19 prevention measures, such as wearing a mask, washing hands frequently, maintaining physical distance of at least 1.5 meters, and avoiding crowded or poorly ventilated places and settings whenever possible. Traveling may place you in areas that are closed, confined, or crowded, the 3 C's, which puts you at a higher risk of being exposed to the COVID-19 virus. Whenever possible, stay in open, well-ventilated settings. While traveling, practice prevention measures, even if you are fully vaccinated against COVID-19. Be sure to follow COVID-19 travel policies and rules, required by venues, transport operators, and travel hubs, such as airports, bus terminals, and train stations. Know before you go. People with symptoms of COVID-19, including but not limited to fever, cough, or shortness of breath, should not travel. If you are showing symptoms of COVID-19, stay home and isolate yourself away from other people. According to World Health Organization, you should isolate yourself for 10 days from the onset of symptoms, plus at least 3 additional days without symptoms. If you have been around someone who has been diagnosed with COVID-19, isolate yourself, follow the guidance of local authorities, and watch for symptoms. If you have been scheduled to travel, call your manning office to inform them about your situation. Any seafarer who had tested, or is suspected to be positive, will be removed from lined-up status immediately, and should receive further medical assessment. Those seafarers who have completed at least 14 days period of isolation or quarantine, in accordance to local authorities and medical center recommendations, may be allowed to be lined up or put on standby status again, only upon receipt of relevant confirmation from the medical center that they are COVID negative. Then the procedures for the lined up personnel must be initiated all over again. Before you travel, know the requirements and policies in place, where your trip originates and at your destination. Keep in mind, every country has its own rules. Some countries exempt travelers who have been fully vaccinated, or have proof of recent COVID infection from certain requirements, such as testing or quarantine. During travel, even if you are vaccinated, World Health Organization recommends, and company policy requires, that you continue practicing prevention measures, like wearing a mask, washing hands frequently, maintaining physical distance of at least 1.5 meters, and avoiding crowded places and poorly ventilated settings whenever possible. Yes, you may be screened when entering or leaving a venue, destination, or country. Make sure you know what is required or expected from you, as you plan your travel. Exit and entry screening may include measures such as interviews, checking temperatures, and evaluation for symptoms, including respiratory symptoms, fever, cough, or shortness of breath. You may also be asked to provide information about any possible exposure you have had to people with COVID-19 symptoms or confirmed diagnosis. Some venues, destinations, and countries may request or require that you download and register with the digital contact tracing app. These apps collect information to identify and inform travelers who may have been in contact with a person who has been confirmed to have COVID-19. Again, the key to success is to know before you go. Some venues, destinations and countries require COVID-19 tests prior to departure or upon arrival, as part of their strategies to prevent the spread of disease. These tests are used in an effort to determine the health status of travelers. As always, continue wearing a mask, wash your hands frequently, maintain physical distance of at least 1.5 meters, and avoid crowded places and poorly ventilated settings whenever possible. Keep in mind, every destination has its own policies, so it's important to be aware of testing requirements before you hit the road. Maintaining appropriate measures during traveling is of utmost importance. The goal is to reach your destination, your assigned vessel, or your family back home, unaffected and COVID-free. Let's take a look at some guidelines. Maintain social distancing. Whenever is practicable, keep a minimum distance of 2 meters. Throughout the transfer period, no handshaking or other physical contact must be permitted. Maintain hand hygiene through frequent hand washing or use of personal hand sanitizer. Avoid sharing items with others. For example, carry your own pen so that you do not need to share. During traveling, try to reduce the interaction with the surroundings. For example, staying at port or transiting at airports should be minimized. Finally, if you have to stay in a hotel or temporary accommodation, confine yourself to your room. Avoid all public spaces, reception areas, elevators, etc. Take your meals via room service, and do not use public restaurants or food areas. If you have any symptoms of COVID-19 while you travel, or when you arrive at your destination, notify health authorities immediately and follow their guidance. Also notify mining office for assistance. You may be required to quarantine or isolate yourself. Your travel companions may also be required to quarantine, since they have been in contact with you. As you plan your trip, make sure you are aware of the requirements and policies in place at your point of departure and at your destination. Make sure you follow them. Be sure to practice COVID-19 prevention measures. Wear a mask, maintain physical distance of at least 1.5 meters from others, wash your hands frequently, and avoid crowded or poorly ventilated places and settings. Monitor yourself for COVID-19 symptoms and follow company protocols. In case you develop symptoms such as fever, cough, sore throat or headache, inform the company and notify public health agencies at your destination immediately. In case you have serious symptoms such as difficulty breathing or shortness of breath, chest pain or pressure, or loss of speech or movement, request medical assistance without further delay. Some airplanes have cabin air filtration systems equipped with HEPA filters, which can remove viruses and germs quickly, minimizing the duration of the exposure to any potential infectious materials produced by a cough or sneeze. The cabin air system is designed to operate most efficiently by delivering approximately 50% outside air and 50% filtered, recirculated air. The air supply is essentially sterile and particle-free. However, adequate ventilation is just one of the preventive measures to reduce the risk of COVID-19 transmission. Other important measures include maintaining physical distance of at least 1.5 meters whenever possible, frequent hand hygiene, and wearing a mask. Passengers should check with the airline company and the national or local guidelines about when and where to wear a mask while flying. If you become ill during your travel, inform your travel attendant on a plane, ship, train, etc. You may be moved to a seat farther away from others. Ask for information on how to be seen by a healthcare provider and seek care immediately. In the first opportunity, inform the office for guidance and assistance. Follow vigorously COVID protection guidelines. Wear a mask continuously while you travel, frequently clean your hands with hand sanitizer, cover a cough or sneeze with a bent elbow or tissue, and maintain at least a 1.5 meter distance from others wherever possible. As soon as this is feasible, you should stop traveling. If you are told you must quarantine or self-isolate yourself in a specific place, you should be provided with free, appropriate facility and care, and not be asked to stay longer than 14 days. This completes the health campaign. Although we realize that all those guidelines and restrictions make your lives difficult, we are asking you to follow them vigorously. After all that matters is for you to be able to return home, or to your assigned vessel, safe, and without harming others around you. Hoping that we will be able to return to normality soon, we thank you for watching this campaign. Stay safe, and stay healthy.